for example, we're looking at hirsutism. It talks about the Endocrine Society guidelines, and you can click right on the little link, and it'll take you straight to the PubMed resource, and then you can go straight to PubMed and get the article. So just a reminder, like, it's pretty easy to get to this stuff through this type of website to double check what the compendia is telling you. I use this every day in my real job. My clinical job. This is my real job, teaching you guys, right? The other part of my job. Okay, so PCOS. Let's go back to this specific patient. So she says she's got dark and heavy hair growth on her face and arms, and we suspect this to be related to PCOS, right, which is an endocrine disorder, probably has increases in testosterone. We are not diagnosing PCOS today. She's already got it on her problem list, so we know this lady has PCOS. What therapy is she on that might already be helping a little bit with her PCOS symptoms? Metformin. Yeah, she's already on the metformin. Good. Okay, so any other objective data in this chart for us to talk about with PCOS today? Not really. We don't have any of her hormone levels, which would be pulled. We don't have much other information besides the diagnosis in there by the provider. So not a lot of other stuff to go on. But her complaint is she doesn't want the hair growth on her face and arms. So what do the either endocrine or the hirsutism guidelines say about first-line treatment for hirsutism?
You want a combined oral contraceptive?
Combined oral contraceptive, yep. So what are combined oral contraceptives that she could choose from? Do they preference one over the other? No, they just say the whole class, anything that's combined. So what formulations are in combined? I know you know that the pill is, right? What else?
The patch and the ring.
Patch and the ring, yeah. Pill, patch, ring are all appropriate combined hormonal contraceptives for treatment of this problem. Then additionally, she's on a bunch of teratogenic meds, right? And she has diabetes of an A1C greater than 10, which is teratogenic. So it's also important that if this lady's sexually active, she's also using contraception. So this is kind of a double hit, right? We know that PCOS also impairs fertility, so she may not easily get pregnant, but we don't know that. So I would say, while taking potentially teratogenic medicines and having PCOS symptoms, it's important to try and pick a therapy that covers all of those bases. Does that make sense? Yeah? Okay. So for her PCOS, any of those hormonal options would be appropriate. She can get Sprintec at Walmart for $9. So that's probably her most affordable option if she's not going to go to the health department and get it for free. And then they do actually recommend starting a particular type of progestin within your hormonal contraceptive. Did you guys read anything about that?
Is it levonorgestrel?
Yeah, they said pick a second generation progestin because it has less thrombotic effects and is just generally well tolerated. The Sprintex norgestimate, it's fine. I would say you could pick any of the, again, combined hormonal contraceptives for those 28 hirsutism guidelines. Specify one that has norethindrone or one of the earlier generations of progestin in it. And then before we prescribe her a hormonal contraceptive, what else do you have to think about?
Is she pregnant?
Yeah, is she pregnant? Okay, so we can do a pregnancy test and she's not. What else? Before you prescribe a med, you have to think about whether or not it's safe, right?
Her blood pressure?
Her blood pressure is high, so what document are we going to use to figure out if estrogen is safe?
The US MEC?
Yes, good job, guys. Somebody remembers. I'm so excited. So the U.S. Medical Eligibility Criteria Chart. Remember that chart, 1, 2, 3, 4? Is it good? Is it okay? Is it not so good? Is it contraindicated? And then the other part to that, so if you go into these endocrine guidelines and you scroll down to the treatment part, they've actually pulled out the U.S. MEC criteria that are most important for women with PCOS. See, right here, 1, 2, 3, 4. Does this look familiar? No restriction, advantages outweigh risks outweigh, or contraindicated. So you can move through this chart and figure out if she's appropriate for using estrogen, either through the PCOS guidelines, or you can just go to the US MEC, which you should be pretty familiar with at this point, because that's what we've used for all of our contraceptive prescribing, and you can go through item by item and check it off there. So for this lady, things that are concerning for her, yeah, for hypertension, so that's technically a 3 here. She's got elevated blood pressure, and risks may outweigh the advantages. What else does she have that could potentially fall on this chart?
Obesity.
Obesity, yep. She's got, she doesn't technically have dyslipidemia, so I wouldn't consider that. Diabetes, she's got some 3s on here too. She hasn't had it for duration of greater than 20 years, and she doesn't have end organ problems. So she doesn't hit any of the checks for diabetes. So she does have some 3s. However, I think this is a case where treating her blood pressure, we're changing her meds. That's the only one that she has an active 3 for, and you will see people prescribe hormonal contraception in this patient population sometimes for that. So this is, again, I'm highlighting for you, in clinical practice, not everything is perfectly black and white. I think this patient would probably be started on hormonal contraception, even though there are some risk factors that we would be concerned about, namely her elevated blood pressure. So it's really important that she's coming back in 2 weeks, getting that blood pressure checked, because if we get her meds dialed in and her blood pressure is controlled, then we feel pretty good about the estrogen on board, right? Does that make sense to everybody? Okay, then after we start hormonal contraception, what monitoring do we need to do for this lady? Pretty much just making sure her symptoms are fine, right? There's no lab safety monitoring, anything else that needs to happen there. So making sure she has less hirsutism and that she's happy with her chosen method. Okay, that's part 1. Any questions about this patient so far?
Just a quick question.
Yes, ma'am.
I categorize this or her problem as hirsutism secondary to PCOS/birth control. Am I supposed to do those separately, or is that okay?
I put them all as one because they're so closely interrelated. Okay, so next, part 2, I'm about to release these 2 things right here. So the follow-up in the chart and then a follow-up conversation. Essentially, we've made all these changes today. We've sent the patient out. She's come back for her follow-up visit, hopefully in 2 to 4 weeks, and you'll be able to see this new data. My note, the assessment and plan that we just talked about is now in there under 1126, so if you want to refer back, it's there for you as well, okay? So it's almost 1:40 at about 5 till 2. We're going to come back together as a group. Remind me, we go to 2:20, is that right?
2:15.
What time does class end? Can somebody remind me, please?
2:15.
2:15. Okay, yeah, so that should be about enough time. 5 till 2, we're going to come back together and talk about the new information. Please let me know if you're not able to access the new data, okay? You're going to have to listen to the audio, I think. I'm not going to play it at large. I'm going to let you do it at your own time on your computer, okay?
I'm Miss White. I'm so glad to see you back in clinic again today. I was worried you didn't come in for your follow-up appointment back in November. How's everything going?
I'm so sorry. I get so busy during the holidays. I just can't do it all. Actually, I'm here today to follow up because I had to go to the ER a few days ago while I was out of town.
Oh no, Miss Whitehead, I'm so sorry to hear that. Why have you been to the ER?
Well, I went on a car trip to see my sister in Alabama, and just about the time we arrived, I got a real bad pain in my left leg. It was hot and swollen, so I went to the ER, and they told me that I had a blood clot. So they then put me on this IV with a blood thinner in it, and after about a day or 2, they sent me home with 5 days worth of shots and some pills, and told me to come see my doctor before I ran out of medication.
Okay. So can you tell me specifically how are you taking the shots? And I think the medicine they gave you is warfarin. Does that sound right?
I take 2 shots. I do one in the morning and one at night, and then I take 1 warfarin pill every day.
Okay, great. So have you missed any doses of your injection or the warfarin since you left the hospital?
No, I haven't missed any, but I only have 1 day left of each.
Okay, great. So today we're going to talk a lot more about
said that I can't take birth control anymore. Does that mean I can only use condoms now? I mean, is that even safe with my medications? And my yeast infection is back again, even though I'm taking those 10 units of insulin every day like you told me to. It's been so frustrating.
Ms. Mike, I hear what you're saying, you've had a lot happen in the last few weeks. So let's take some time to sort through your new bags, check some blood tests, and come up with a plan to address these medication issues.
We're doing this all again.
I'm so over this.
Oh my god.
So now she just has a DVT, and that's one didn't work.
And now she falls into that recurrent category.
So she can get like depo, but that's not what we're gonna do.
No, I was talking about recurrent vaginal yeast infections because now she's had 4. So now she has to take like fluconazole for like 6 months or something
She's having a
ridiculous like that.
DVT, so she's not like a candidate for
No estrogen.
estrogen.
So now she either needs to get a shot.
Probably do that.
Yeah.
Probably do that. Or
But she has to have something with
Good.
estrogen because she's
that's
PCOS.
recommended, but she's not a candidate for that because of her DVT.
DVT.
Oh man, never mind. I was reading the guidelines, but I closed it.
And then I give her 6 grams fluconazole 3 times a day for 10 days.
I really don't feel like going